If your overseas student health cover claim comes back with a lower payment than expected, or zero, it does not automatically mean your insurer has completely denied coverage. Check your written decision carefully. You need to identify whether your claim was fully rejected, partially paid, subject to an out-of-pocket gap, missing information, or simply for a service outside your policy. Identifying the precise classification is the mandatory first step, as it determines the specific process for resolving the medical bill. While all OSHC policies are regulated by a government deed, individual insurers offer differing coverage limits. Base cover does not automatically include extras like routine dental work, optical services, or non-emergency ambulance transport. Out-of-hospital coverage creates the most confusion. Base policies generally cover 85% of the Medicare benefits schedule fee, known as the MBS fee. They do not pay 85% of the doctor's total private invoice. If a doctor issues an invoice of $120, but the government's MBS fee is $80, your 85% benefit is calculated strictly from that $80 base. This results in a $68 payment. That leaves a $52 difference. This is your out-of-pocket gap. Doctors are legally permitted to charge above the standard MBS fee. An out-of-pocket gap is standard practice in Australian healthcare and does not mean your insurer rejected the claim. Claims also frequently fail due to administrative errors. A common issue is receiving treatment before your cover start date or after it expired. Claims will also bounce if a spouse or child was never officially added to the correct membership category. Then there are waiting periods. Emergency treatments carry no waiting period. However, waiting periods for services like pregnancy depend entirely on your specific policy duration and insurer transition rules, requiring you to check your individual schedule. As the highlight moves to the first marker, the legal assessment for pre-existing conditions considers whether any medical signs or symptoms existed before your cover began, even if you hadn't received a formal diagnosis. Sometimes a claim is just pending. If you are missing an itemized invoice, a provider number, an MBS item number, or a required medical certificate, the insurer will hold or return the paperwork. Making assumptions about dependent coverage or waiting periods leads to invalid disputes. Your policy schedule and insurer rules provide the actual details of your coverage. If you need to push back on a decision, start by asking the insurer for the exact reason in writing. Request the specific policy clause and the benefit calculation, rather than relying on a brief app notification. This framework shows your formal escalation route. First, submit an internal review to your insurer with your supporting medical evidence. If the dispute remains unresolved, you can take your case to the independent Commonwealth Ombudsman. A disputed insurance claim must never be used as a reason to delay urgent medical care. If you are facing an immediate life-threatening emergency in Australia, call 000. International students possess formal, free consumer rights to challenge insurance decisions. These rights are effective when you gather the correct written evidence and understand how your specific policy framework operates.